This program is brought to you by Chicken House, Porsche Store, Ting Ting's Native Food, Ubalaba Ilonggo Wear, and Jong Tapsilogan and Sizzlers.
General, thank you so much for your time and thank you for allowing us to have a chat with you.
Yeah, thank you also for this opportunity to share our experience here in Bacolod City, especially at the Emergency Operations Center.
Sir, first of all, before you came to Bacolod, how would you describe the situation dito?
Well, actually, at the time we came here on the first week, to be exact, on the 1st of September, it is at that time where, you know, Bacolod City is considered as epicenter of the crisis because at that time the daily cases are really high. They reach up to three digits for consecutive days, no? I computed it based on the result of the laboratory in the 4 days, no, from in the first week of September. It's at 125 cases daily at that time
On the average?
on the average. But of course, it's at times it's 125 and it becomes lower and it's higher again. So it's that kind of situation that Bacolod has during those days.
Mhm. And given those figures, yung Bacolod ba, was it headed to becoming the new epicenter in the Visayas or in the entire Philippines?
Well, having those figures and having no actual systems and processes in place, in fact, that's the main cause on why these cases rose, no, in those days. It's because of the absence of those systems and processes that are in place. Yes, of course, it will even rise, and it will, you will not know what damage it could have if it was not there were no interventions in those in that day, the first week of September.
Now that you're about to leave, how would you describe the situation of Bacolod now?
Well, I can say the situation now in Bacolod is stable, and uh, fourth or fifth week ago, the average daily cases is at the 50s. And 3 or 2 weeks ago, the average cases is at the something like 25 cases daily. Now I can say the cases are lower than 15, and I'm uh, confident, no, and optimistic that it will be more low. It will be lowered in the coming days because of the efficient and effective EOC, of the city.
Mhm. Let's talk about proposals later on, ano? But let's talk about the figures first, sir. What did the local leadership do right and what did it do wrong in approaching this problem?
Well, actually, there were also interventions. There were systems and processes that were, there in place when we arrived. But I believe there are missing principles like principle of having centralized, unified approaches and other principles. Bacolod City prepared for this. There were these isolation facilities that were in place. Actually, there is this EOC that was set up previously, but probably just lacking some of the systems and processes and the structure itself and how to make it like all the interventions collaborative, coordinated, synchronized, and harmonized. And when I arrived, actually, there were interventions. There were activities that are at the barangay level and are not directly linked to the EOC. So with this kind of approach, when it is not centralized, it's really hard, no, to have that right focus and unifying all the interventions that are needed in a specific situation from one barangay to another barangay or other places, or even in the some of the business establishments, the workplaces, something like that.
Yeah.
So there is a huge consideration in addressing this COVID crisis.
Nagsimula po yung quarantine dito February, GCQ. It's been like 7 to 8 months from now, since then. Uh, should the EOC should it have been established way back pa sana? I
Yeah.
mean, before September. What was the ideal approach, supposedly?
Well, actually, establishing EOC is having that structure, a structure that is lean and mean, and it has that command direct from the center. So it's the head of the emergency operations center plus of course, the deputies. There is this deputy for operations and administration. There is this deputy for medical and cluster heads that should be established that will work in collaboration. So that is the proper setup of the OC, and of course there is this the OC should be acting on data always. It's a data driven activity, and though that data should be real time. So there were lots of efforts in doing this, how to get the data from the different laboratories here in Bacolod City, plus that of molecular lab in Silay, no, the Teresita Halandoni. So we had lots of meetings regarding this on how to get the real-time data. Uh, the acceptable time is within 48 hours.
Mhm.
And when we arrive, there are results, the laboratory results that are even more than 7 days. So that factor alone is it's a huge concern in fighting COVID, having the real time and factual data.
All right, allow me to discuss that further, sir. So before you came here, yung nangyayari was walang EOC. Basically, walang EOC. Walang data center. Walang deputies for medical, walang deputy for operations. So basically, what happened before was merong city health office, merong local IATF, but walang centralized command system, kung baga.
Yeah.
Okay. Very interesting yung sinabi mo na before, yung data from the testing centers would reach the local city health sometimes as long as 7 days.
Yeah.
Uh-huh.
Some are more than.
Mhm. Now, how important is that? Pag delay yung data mo, ano yung effect?
Well, actually, pag na-delay yung data mo, delayed yung intervention mo, no?
Mhm.
You can just imagine from exposure ng isang individual to that virus, and upon the manifestation of the symptoms, mabilis yan.
Mhm.
Within few days, a patient that is only mild can turn into moderate, severe, or critical right away. So, of course, it will cause more mortalities, no, among these patients if there is no early detection and there early health intervention. So, importante yan. Kaya when we arrive, actually, I brought with me Dr. Jean Loreche, an expert pathologist in Region 7. She's expert in laboratory processes, no, and capacitating the laboratory. So yun ang inuna namin, no, tiningnan to accommodate all the testings of Bacolod City and other LGUs outside Bacolod City to have that real-time data. Tapos, we also met all the laboratories, hindi lang isa, dalawa, tatlo, but we regularly meet them to really have that real-time data, because the activity at the EOC is data-driven. Once you get all this data, there is this data management cluster that will sanitize it, that will analyze it. Then when it is, it's already a clean list, what we call it a clean list, it will be a shared data. There is a system that was established. Once there is this sanitized list, it's a shared list among all the clusters, no? Like for example, what are those clusters that are implementing those interventions? Number one, which is actually the heart of the operation, is the contact tracing. So upon receiving this, the contact tracers will go down, no? And it is a shared list because it will be shared also to all the barangay captains that are having those cases. And that is being done through the presence of the Liga ng mga Barangay in the AOC Center. It was Cons Gles Panen, the Liga ng mga Barangay President, who was present from day one. We sat there up to the last huddle that we attended was last Thursday. She's there. She was there every day, having all these responsibilities of disseminating all the the data and making awareness program to all the barangay captains. So once the barangay captain will receive it, they will now go to all these places of the positive individuals, the household. So initially they will implement quarantine or lockdown on all those households. No, then here comes the contact tracer who will link with all the barangay captains, guiding them to those households and having their interviews. It's called the contact tracing activity. They will interview the positive index individual by determining all the historical activities of that positive individual and getting the different close contacts, whether inside the households or neighbors or in the workplace, in their workplaces, or uh, going to and from in transit of all the activities. So all those close contacts will be determined. Now, simultaneously doing that, here comes another cluster, the extraction cluster, who has also the data. It's all a shared data. That's why it is important if it's really real time. So the extractor will get the positive individual and be placed on the quarantine facility or isolation facility. Now another, here comes the swabber for testing. All the close contacts will be swabbed and tested, right? Then another cluster is the logistics. So the logistics will go and give the provisions for 2 weeks. These are all simultaneous. Then another one is, of course, the isolation facilities will accept all these positive individuals. Then there is this monitoring also, monitoring of all these household. Uh, the we call it patient monitoring. So all these things are made, no? And there is also the patient monitoring is the one also facilitating the referral system, whether a patient will go to the isolation facilities or if it's a moderate, there are doctors that are assessing these patients. It will go to the hospital. And we also have this established one hospital command. Actually, one doctor, a volunteer doctor who was in charge of it. It was Dr. Hector Gayares. So we actually have the coordination among these hospitals, and on a daily basis, these hospitals are giving their census. So we know, for example, for today, I have the data already of how many COVID beds are available among all these hospitals, how many are health workers are on quarantine, how many health workers are available. We know the capacity of each hospital. So with this referral system that we had, actually it helped decongest the hospital because there is a referral system that is in place. So from the community, from the household, its positive index is referred to either at the isolation facility or to the hospital. It's the doctors are the ones doing it. So there are no mild patient. Previously, there were these patients that go straight to the hospital and it made the hospital congested. Now, when we arrived, actually, uh, the hospital capacity is at critical. It was at 98%.
Mm-hmm.
And there, at the time, I remember there were only 2 beds available. And there were, if you are having these cases on 100 basis and you only have 2 beds available, what will happen? So there were those patients actually previously that were not accommodated.
It was critical.
Yes, and of course there were lots of deaths because they were not accommodated in the hospital. In Cebu, it also happened. Patients were dying inside the ambulances. Many patients were dying. So there were also patients here who succumb to that because of that kind of situation. Some are being sent outside Bacolod City already. So when we immediately engage all the hospital owners, administrators, and other officers, we readily established this one hospital command, and we complement it with the referral system that we established on the ground, so that only those moderate up will be admitted to the hospital. So it helped decongest. So right now, the latest the capacity utilization rate is at 40s. It started from the 90s, then after a few weeks, 80s, 70s. There is this gradual lowering down of the capacity utilization rate of the hospital. 50s and now it's 40s.
Uh-huh.
So there are about 100 beds, both COVID beds and ICU beds that are now available. And we also sharing it to the province that they can also uh, you know uh, they can also bring their patients here because there
Mhm.
are already available beds. So,
Mhm.
so that
So
those
we
are
can now accommodate patients from Cebu
no,
and
no. I
other
mean
places.
in the province
In
in
the province.
Negros
Before it was
Occidental.
outbound. Yung patients
Before when we
dito.
came, some are being sent outside the Bacolod
Mhm.
city. Uh, and now there is this available bed. So, and there are also other facilities that are actually, in fact, because of the lowering of cases, many of the isolation facilities are already, emptied, and we are just now focusing to some facilities. No, and we even accommodated the LSIs in those
Mhm.
facilities. And these are the temporary treatment monitoring facilities, the converted school buildings. These are the school buildings that were converted for that purpose.
Sir, while you were talking about the structure and the operations, pardon me, but I can't help but think of World War II. Yung parang combined arms warfare na you are commanding a lot of units, and allow me to use your term, na yung timely and real-time information is yung tawag nyo dyan sa military mission critical,
Ano yan? Evidence-based.
evidence-based,
Yeah. Intelligence-based
intelligence-based.
data.
Mhm. So without that, like Sun Tzu, yung intelligence is very critical.
Yeah.
Aha, very interesting. Bakit wala yan before? Bakit wala sa Bacolod before? I mean, itong sinasabi mo, isn't it being cascaded from the national IATF down to the local IATFs?
Well, we're sharing this actually. These are actual experiences. It started in Cebu. We just replicated what we have done there, the experience and the good practices on how to set up an EOC. Uh, be, uh, Probably because when we arrived, to be honest, there were no data available. And I'm talking of the real data.
Mm-hmm.
Because at that time, from the laboratory results are passed to the RESU, to CESU, and I have learned that the EOC has no direct connect to the CESU data. So what they gather only are the data that are, that are being worked on, and those are not the true reflective data on the ground. So as I was during those days, we need this factual and real time data. Our activities, when I sat there, I immediately told them our activities should be based on the concrete conditions on the ground always. It's a driven data, and it is always situational. And you can only do that in the daily huddle. They don't have the daily huddle.
Mm-hmm.
So the first time we sat down there is this what we call the daily huddle. We, we talk there, and when I introduced the structure, of course, there were these different clusters that have their, just like a job description in the corporate world. There are tasks in all those specific tasks for each cluster. So every day we go there, and they will be presenting their activities, what had happened. So we're sitting there and making some critics and introducing further other the system flow, the processes that should be established in those different clusters. So it's a daily thing. From Monday, we are there at 8 o'clock up to Saturday. At times, we go beyond 5 o'clock just to discuss all these processes and systems on a daily basis. No? And of course, there were also some meetings that are, scheduled during the day in all the different stakeholders, the business sector, the doctors, the hospitals, and other relevant stakeholders that we have, the laboratories, but we have several engagement uh, uh, simultaneous with the daily meetings that we were having at the EOC. So actually, this daily huddle, this is a significant one. In fact, it's the main factor on how intervention should be uh, collaborated, because you talk every day, you synchronize all the actions. Like what I have mentioned a while ago, it's a simultaneous thing that is happening on the ground when the data is already there. And of course, they should be in harmony, uh, all those interventions.
So parang it was like fighting at night without night vision goggles.
Yes, well, COVID is a uh, complex problem, right? And you need, a comprehensive approach also, and it should be holistic, no? So because COVID, you don't see it, and it could transmit to, to everyone anytime. So the approach should be holistic also, on how to address it, especially integrating the human behavior in the, in the communities, in all the business establishments, within the households, and even there at the OC. You know, I think that's one huge factor also on having a culture of trust and confidence. When we sat there the first time, we don't know anybody
Anybody from?
in that EOC.
Oh, uh-huh.
No, we don't know anyone. Even Mayor Bing, the first time I met him. No? So of course we are looked into there when we sat there. This guy is a military man, probably, or I'm seeing the faces of all the people there, especially the cluster heads, of having that kind of apprehension. will this guy or this team do here? Will be militarization be applied here? So, you know, that's why it is really important to have those trust and confidence.
Yeah.
I've seen also in some of the cluster they don't work with having those trust. Just like I experienced the doctors working with the police. Probably the first time they work in such crisis, having a harmonious working relationship. I did not see that, but because we sat down there and we introduced some principles also, and that principle is guided. I always say it's a five-word principle. Let's do the right thing.
Let's
Basta
do the right
basta
thing.
gawin lang natin yung tama. Yun ang palagi kong sinasabi. If you think what you will do is right, do it. So daily, that's our guiding principle. And probably in the days of having this the huddle, they were able to realize that what we are doing is to have an EOC that will help Bacolod City, an EOC that will help save the people of Bacolod City. Yun yung parang nakita nila. In fact, I was very emotional on this, no? Minsan I'm being carried by my emotion every time I say this. We want to establish an EOC that will save, that is effective and will save the people of Bacolod City. Because at that time, there were, at the average, Bacolod City is having like 2 deaths a day during those times. So that's probably the guiding principle that was experienced and felt or seen by the people at the OC, that they were able to realize that it's for Bacolod City. It's not for us, the team. It's you know uh, that changes the environment on a day-to-day basis. That's why I always say that an effective EOC is I benchmark it always. Of course, aside from the systems and processes that should be in place and institutionalizing these systems and processes, I always benchmark it on having an EOC that has that trust and confidence, and an EOC that has that culture of commitment, hard work, dedication, no? And having that uh, harmonious working relationship. And you will see that now at the EOC. The people there are really dedicated and hardworking. No, it is that kind of culture that I'm expecting. No, with our daily activity, just like in Cebu, when we left, they have that kind of culture, and that's why when we left, I said, no, I'm very confident of the EOC here in Cebu City because of this culture that was established. In fact, you will have that feeling that you are like interested or enthusiastic to go there at 8 o'clock and meet and talk even the whole day. You have that kind of that feeling. So that's the culture that actually that made the EOC as effective right now.
It's hard to understand na you are getting emotional right now. Siyempre, military officer kayo. But what makes you emotional about this?
Actually, ano pala mahina yung loob ko pala dyan sa I was, nakikita nila doon na stricto ako, no? At times, in fact, maraming beses ako nag-ano dyan, tawag namin dyan homily. Yung bang, up to the point of raising your voice just to emphasize what is supposed to be done, no? But I told them it's not really intended to anyone, but on the actions and the behavior, on how to, be part. of the EOC as a team. So sabi ko nga, stricto siguro, pero at times when it comes to, service, siguro nakikita nila yung nandun yung sincerity on really how to, help Bacolod City. Yan yung palagi kong in my mind, how to, address the crisis, especially lowering the mortalities kasi marami na yung 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 mortalities talaga ng Bacolod City that I want to really reduce it and make Bacolod City safe for everyone.
Sir, this is a very personal question for you, if you may. You were one of those included in the case about the alleged abduction of Jonas Burgos. Uh, and you have been accused for so long as a verdugo, a killer, and now here you are being very emotional about saving lives. Yung mga allegations na ganun, does it play a role in shaping your psyche?
Well, actually, it was the act of at that time, the Communist Party of the Philippines. Of course, in fighting an opponent, you have to establish some, you know, narratives or messages that would influence one's mind. And for me, it's part of their ideological, political, and organizational work uh, that they should be having this kind of narrative, to in furtherance of their organizing works and recruitment of the different sectors. So it's part of the strategy that was adopted by the Communist Party of the Philippines, and I know that. That's why I'm not really reacting on that. But as far as saving lives, actually, it's more on I'm more on saving lives than the neutralization of let's say an adversary or enemy of the state. If I can, convince them or engage them in a peaceful way and uh, embrace the offer of the government, I will be more on that process than having this conflict in an armed confrontation, addressing such conflict in an armed confrontation. That I think that's the last resort that should be undertaken.
Mhm. Sir, let's talk about benchmarks. Ano po ba yung dapat natin tingnan to say that when you came here, your stint for several months, like 3 months,
2 months.
2 months,
Yes.
how can we say that it has improved the approach to COVID?
Well, actually, as I can see now, even we are not at the EOC, even at night time, early morning, or 24 hours, we have a different chat group with these, clusters of the EOC. And even at the barangay captains, we have also our chat group. So we're seeing, just like you're sitting there from 8 o'clock up to, in the afternoon or up to evening, we are having this huddle. We're talking. Every time, it's just like your daily routine. Every time you wake up early morning, you will see your chat group there. There are these huddles, talking of a patient, what will you do with this, talking of some concerns on how to address it. Then here comes the suggestions and everything. So it's a daily thing that is now happening. Even beyond office hours, it's a 24/7. Yesterday it was Sunday. Today it's holiday. We had daily huddle in the chat group. So this is how the EOC now Bacolod City is set up. No, there is that that what I talked a while ago, that culture of commitment and dedication of all the EOC cluster heads. In fact, they are considered the real jewels of Bacolod City or the EOC or Bacolod City. They are there to really, work for Bacolod City to save lives.
What I find interesting sa sinasabi mo is the fact na basically yung kailangan talaga is a unified command. Uh, may mga elements in place like merong operations, merong data, but yung system wala. So basically what you did when you came here was to put in place that system and have a you basically acted as as the field commander this time.
Yes, it's always like that, having those issues, because you will execute it. You will trickle it down, and you have to also connect all the barangay captains. In fact, all the barangay captains are part of the EOC now. We had this regular engagement also with all the barangay captains. I call them so many times in a weekly basis, to talk on some concerns on how to harmonize. If there are concerns in a barangay, we call the attention of that barangay and tell them upfront what he is supposed to do. So having all these activities now make it like a unified one from that EOC headed by the mayor, Mayor Bing Leonardia, down to the BHERTs of the barangay captain, barangay council, the BHERTs. They are all one command now. So every time there is a concern in this barangay, it goes to the data management, it goes to the cluster, it goes to the barangay, and there is this, feedback. So there is just like what happened in one hospital, the Bacolod Queen of Mercy. There were these cases 2 days ago. All the doctors were all focused there on, how to have that case study on those. And immediately there were data that came out where those transmission happened in that hospital in a few minutes only. Actually, it's not even an hour. The data came out. It happened in this station, in this area, in this area, in this area. So right now, what will Bacolod Queen of Mercy Hospital will do is to submit a case study, and of course, EOC will be there to assist and help that hospital. It's just like these cluster heads who are doctors are ganging on that concern. On that day, they have. If you will not look at your chat group for an hour or 2 hours, you have a long messages you have to read because all the interactions are there. That's how aggressive and proactive the EOC. So as far as another surge, I don't think so. It could always be contained by the EOC. Even Bacolod City will open further the economic activity.
Sir, can we say that now yung community transmission has been arrested?
Well, there are, but if the cases are analyzed daily actually. Let's say, for example, if there are 10 or 15 or 20 cases, there is this classification of cases. Like, for example, 20 or 15 are close contacts. So it means to say that these close contacts are on the household, so they are controlled. You will be only, be concerned on the 5 index cases. So those index cases are being really analyzed as the patients are assessed, so that you will know where was the place of transmission. So that's how detailed is the assessment and analysis of the cases on a daily basis.
On this?
Daily basis. So after a while, this 15 will be, cut because they are on a lockdown. And you will be concerned on the 5 new cases, index cases. So every day, if you will do that, you cut its case, you stop its case not being transmitted. So that's why I am confident that in the coming days, because of that process, the cases will go lower further.
Sir, let's talk about moving forward. May mga business groups ngayon that are proposing na kung pwede i-allow na yung leisure travel. Do you think it's feasible right now?
Well, there are always guidelines that are looked into by the EOC, and these are implemented through an executive order or ordinances or whatever. So the EOC always look into it. That's why if the economy opens further, I say, okay, okay, you can go. But of course, we are living in this kind of it's a new normal that we're having now. As long as there is no vaccine, you have to abide of the protocols and guidelines always. There are those protocols and guidelines that are in place. And as far as you cannot as long as there are COVID, you cannot avoid transmission, right? You cannot really zero the cases, but as long as it's maintained at the lowest possible level, and there is this capacity healthcare that the hospital can provide, we can learn actually to live with COVID.
Mm.
We can learn.
Sir, may mga proposals din na kung pwede, parang uniform quarantine level na lang for a particular region. Example, pag Region 6, kung pwede, these are coming from businessmen, ano? Kung pwede, parang uniform quarantine level na lang for all the provinces under a particular region. Is that even possible?
Well, that's the ideal thing to do, actually. But it's always situational. Like for example, now in San Carlos, where they are having a rise in their cases, of course, the LGU, the mayor there should have its own guidelines and protocols, which is not similar, no, with other areas that are having lower cases. So it cannot be that uniform, no. But that's the ideal. But it depends on the situation. Some LGUs will have a stricter protocols or guidelines than other LGUs because of the current situation on their localities.
Mhm. All right. Now, finally, sir, on a personal note, when the pandemic started and President Duterte started appointing people to run things on the ground, yung one very, very, I don't know, you can call it harsh criticism is yung sinasabi na, why is the President appointing generals who don't know anything about health? Would you care to react to that?
Well, actually, personally, this is a health concern. That's why at the EOC, majority of the cluster heads there are doctors. It always starts with the doctors. When we arrive, before we arrive, actually, I have, communicated, or my wife communicated to the doctors organization here, and getting the real situation on the ground. And when we arrived, we immediately engaged the doctors. And when we were also in Cebu, we arrived this day, the next day, I was in meeting with the Doctors Association in Cebu, and thereafter the hospitals, because they are in authority to lead this pandemic. So what we are doing actually is just to facilitate the implementation of their intervention. And probably, being in the military, we're used to having such crisis. So we have these systems in mind, the structure that can work, and we have been exposed in this since we were young as lieutenants after we retired. So we have at least this system that could be adopted by this intervention by the doctors that will complement you know, all uh, the implementation of the different interventions, and also introducing some concepts on how to do it. That's probably our role. No, it's not. That's why we're not the one really that are imposing. It's just like facilitating all these medical intervention programs.
And oh, by the way, ikaw yung first adopted son ng Bacolod pala, ano? You and your wife are the first adopted couple. Congratulations.
Yeah.
Uh, would you like to leave anything for the people of Bacolod? Would you like to say something to them? Finally, sir.
Well, we are we really deep from the bottom of hearts. We thank the city government and those that who were involved in this. Of course, specifically Mayor Bing Leonardia uh, for giving such a special honor of being adopted a couple of Bacolod City. But I always attribute it and want to share it to the many people that have really contributed in addressing COVID. And these are the EOC cluster heads, no? The Office of the Presidential Assistance for the Visayas, who who really supported, all the activities here. Of course, to the uniform men that were also on a day-to-day basis. They are the ones implementing the quarantine level. They are the ones there on the street doing their respective tasks given to them. Of course, to all the barangay captains, barangay officials, the be hurts, no? Especially those front line. They are actually the frontliners, no? And yeah, I really share this honor to the very active, dedicated, and hardworking members of the EOC headed by Mayor Big Leonardia. We really, and especially also the hospitality that was given to us, the care and the love that was given to us. We will cherish that. As I have said, we'll cherish it forever. And we are really, really, from the bottom of our heart, thankful to Bacolod City and Mayor Bing Leonardia.
General, maraming salamat po.
Okay.